There are a lot of footnotes and details that I know is on the website people can access if they want to have some, some more of the background information, but this is kind of the highlights on here. But when we looked at the numbers, we determined that around 154,800 low-income adults in Alabama could still gain Medicaid coverage if the state were to expand. And that's considering some eligibility changes that happened at the federal level, work requirements, other things that you all can talk about that too. But it's a little bit of a reduced figure of how many people might be eligible than we would have said a year ago. But if Alabama were to expand Medicaid to all those folks, we see some major savings to the state. And I'll walk through what all of those are, but the big headline is that $181 million in sort of direct savings to the state just in 2026 if Alabama were to expand Medicaid. And considering costs, there's always a cost to anything with Medicaid as we go. But after costs, we still see a net of $71.8 million in savings. And of course, just millions more to the adding in state taxes and economic activity that's generated by Medicaid expansion, and a greater basis for a long-term sustainability for the healthcare system that's so important in Alabama and other states. So I'll walk through all of that, how we came to those conclusions. So as you all are very aware, the coverage gap exists in Alabama. More than 12% of adults are estimated to be uninsured. Certainly some of that number are people that are in between jobs or have chosen not to purchase their own insurance or higher income folks, but the data says that around 161,000 adults fall into the coverage gap, as Debbie was talking about. So that's people that earn too much to qualify for the Medicaid that's offered to them in their state, but not enough to afford private insurance on their own. And for many of them, not even enough to get a subsidy that would help them purchase that insurance. So they're really, really stuck and have no way to get into the healthcare system. But of course, they all have healthcare needs, and they show up to a hospital or safety net provider in need of care and have no way of paying for that care. So this puts tremendous strain on the healthcare system, I think, as you all know and appreciate. And this is the reason why, 40 states and plus the District of Columbia have all decided to expand Medicaid as a way to close that coverage gap, to find coverage solutions for those adults who are left out of the healthcare system and reduce the strain on healthcare providers that are seeing a lot of uninsured patients. So this is just the chart from the fact sheet here pulled up on the big screen. So you can kind of just calculate, how much does the state spend for different categories today, and if we expanded Medicaid, how would those costs shift, and what are the savings? They're kind of in the middle. So there are some groups of adults that do qualify for Medicaid coverage in Alabama, pregnant women, some people with disabilities that qualify for Medicaid. The state has to pay its share of costs for those individuals. If the state expanded Medicaid, all of those folks, or most of them, would shift over to the Medicaid expansion, right? And the benefit to the state there is that the federal government just pays a lot more. Thinking about pregnant women, every prenatal service, labor and delivery, all the postpartum care, all of that the federal government today is contributing 72.63% towards. Now they would be contributing 90%, right? And so that 17% gap is what we're measuring here. That's how much more in 2026 Alabama will be spending on healthcare for those folks. And then you can see it really adds up. So for pregnant women, Alabama is losing $37.4 million in this year by spending more on those populations. In other words, flip it around, if we expanded Medicaid, the state would save $37.4 million for pregnant women. People with disabilities, we estimate $30.2 million. And then there are other types of costs that the state incurs every year caring for people in Alabama. the health department and the mental health substance use programs, of which there are many, those are often utilized by people without insurance who would qualify for Medicaid expansion if we had it. Those types of services are paid for, by the health department through that budget line. If we expanded Medicaid, the federal government would be paying 90% of those costs, right? So, same with incarcerated populations. In states that have expanded Medicaid, when anybody needs care outside of the carceral setting, if they have to go to a hospital, Medicaid will pay for that. And if you expand Medicaid, will cover 90% of the cost. So there's just a flavor of, certain, drain on the Department of Corrections system, health department that's paying for a lot of services that Medicaid would pay for if we had it. And finally, there's what we call uncompensated care costs, but care that's provided by hospitals and providers, but is not paid for, right? The state is still on the hook for that care. The state of Alabama runs certain hospitals and facilities, and it supports others that serve a lot of, Medicaid, would be Medicaid eligible folks. And so that's a lot of cost to the state each year. So we estimate that if Alabama were to expand Medicaid, it would save $72.6 million in those uncompensated care costs. So adding all of that together, $181.6 million in lost state income and extra expenses in 2026 by not expanding Medicaid. Of course, there is a cost to expanding Medicaid. The state has to pay its portion, it's 10%. And so we calculate what those costs are. $100.8 million in the healthcare costs. There's administrative costs to enroll all those folks in Medicaid. But even after we factor in all of those costs, you would still have this large net savings to the state of $71.8 million in 2026. So those are big dollars, and of course those are every year, and those, as healthcare costs are growing all the time, so do the savings by expanding Medicaid. Back here, these are just the costs that we could kind of take the calculator out, number crunch, figure out how many people would be on Medicaid, how much we would save, and we can come up with these figures. But we have 41 other states that have done this before, and we know that there's all these indirect savings and larger economic impact that come from Medicaid expansion. And it's hard to put an exact dollar figure on it, but we assume that should Alabama expand, it would have the same experience as all these other states, and having this larger economic impact. So I sort of organized things in four main buckets. Higher labor market participation and wages among low-income workers that come after expansion. Healthcare sector job growth is number 2. Lower healthcare costs for small businesses. Reduce poverty and medical debt for working families. So these are really, really important factors that states have seen after they've expanded Medicaid improvements on all of these. So I'll just walk through each one. So thinking about higher labor market participation, so why would we see that after Medicaid expansion? I think there can be sometimes discussion out there, or thought or feeling that if you expand Medicaid, if you give people Medicaid, they won't have a reason to work because they'll just have health insurance. That kind of thinking is sometimes out there. And of course, we all know people have a reason to work to feed their families and to live their lives, and people have plenty motivated to work. But for some folks who do achieve Medicaid today in Alabama and other states, because of their healthcare needs, they may have to kind of make sure that they stay at a very low level of income to maintain the Medicaid. So, for Alabama, they offer Medicaid to caretaker or parents and family caretakers up to 18% the federal poverty line. So you've got to stay at a really, really low income level to maintain Medicaid. But what we've seen in other states is that expand Medicaid, now, if you, Medicaid expansion would be up to 138% of the poverty line. So if you can now jump from 18% where you're at to 138%, right, you could take on a new job. You could pick up extra hours. You could have part-time work. You could participate in the workforce in a way that maybe you couldn't have before because of your healthcare needs for yourself or your family, right? So in states that have expanded Medicaid, we've seen a 6 to 9% increase in workforce participation that comes as a result, just because people can make choices to support themselves and their family. We've seen 9.5% increased income in other states. And the estimates for Alabama that we see 20,000, more than 20,000 more jobs per year. I'll explain where some of those come from, but it's a lot of folks who can take on new jobs, take on new work because they have Medicaid. This larger figure, this $2.76 billion figure, is an older estimate, but they're taking their 2026 estimate from an older report. But thinking about this larger economic boost to the state that you would expect after Medicaid expansion, given the pattern and history from other states. So we think about the importance of Medicaid to health sector job growth and the local development that would happen around the health system. So with Medicaid expansion, we have fewer people uninsured, right? Increasing reimbursement, so hospitals are getting paid for the services that they provide. So this is reducing that problem of uncompensated care and creating a health system that's more financially stable, right? And with that, and with a more financially stable healthcare system, we can hire more folks. We can hire that specialist in a rural community that might be really needed. We can hire additional physicians to support the community. Of course, all of those decisions, those are helping people on Medicaid, but it's helping the community at large have a robust healthcare system to care for its needs. And so you see in data across other states that every additional physician who's hired in the community will generate 17 additional jobs and over $3.2 million in additional revenue within a community. So it's important to be thinking about the stability of the healthcare system really generates a lot in terms of jobs and economic growth in the state. Small business owners, I think, is an important aspect to consider in terms of the importance of Medicaid expansion. So you can see here in Alabama, the estimate is about 48% of small employers. That's employers that have fewer than 50 employees. About 48% of them currently offer insurance to their employees, versus 96% of the large employers in the state. So it's really hard for small employers to remain competitive if they can't offer health insurance to their employees. And they're really depending on the availability and affordability of coverage somewhere else outside of their business, right? And so hoping that people can kind of afford plans on the state marketplace. Debbie was already talking about the changes that we're seeing now. People are already finding that coverage unaffordable. And so for lower-wage employees, when marketplace coverage healthcare.gov, right, is unaffordable, Medicaid is really going to be their only option for coverage. But, if we expand Medicaid and all of those lower wage employees can access Medicaid, they feel less locked into jobs at larger firms, right? They could take on a job at a smaller business. They could spin off on their own and become self-employed and, innovate and start a new small business. They have some decision making they can make, right? And that's important for small businesses. It increases that pool of talent that's available, helps those businesses grow. So this is a really important aspect that other states have seen, that it really is a boost for small employers and can help raise wages for their employees. Okay, so this all leads to what, a really important aspect of Medicaid in breaking that cycle of poverty, right? So we think about how we are today. Alabama, has 1 in 6 Alabamians currently live in poverty. So when people are uninsured, they can't afford the high cost of care, leading to medical debt, leading to being at risk for poverty. I saw this is a statistic from 2016, but I think it's probably still really applicable. So in 2016 alone, high healthcare costs pushed 10.5 million people nationwide into poverty. Right? Those medical expenses that they needed to care for themselves, their family, but they couldn't afford, and that amount of medical debt pushes people into poverty. And so we see today already 31% of Alabama residents have medical debt, and that median medical debt is over $2,200. But with Medicaid, we kind of flip this all around, right? With Medicaid, there's lower costs to the individuals that are on Medicaid, low cost sharing, the little co-pays you pay when you go to the doctor, that's all kept very low on Medicaid, so people can afford, to go see doctors. Since Medicaid is covering healthcare expenses, we have much lower medical debt. So we see in states that have expanded Medicaid, reduced medical debt by over $1,100. That's a 2018 figure. So it's really major, really significant. And we see that Medicaid coverage has led to a 17 percentage point reduction in poverty in states that have expanded. But of course, there's challenges, right, in the system. We can't just expand without thinking about the cost, and Medicaid's not the only thing that's expensive today, right? We have a lot that's on lawmakers' minds around making sure that we're able to cover the traditional Medicaid population, SNAP, all the other, things that we're worried about in the budget. And so, HR1 is what the big beautiful bill. It is making a significant cut for a lot of states, so we have to acknowledge that. Even as we found, in our report, that even after costs, the state would still save $71 million from expanding Medicaid, but we shouldn't have to raise any new revenue to expand Medicaid. At the same time, we do need to be thinking about the Medicaid budget, and there are options in Alabama to raise revenues that may be needed to support Medicaid and healthcare systems. So some ideas on the board. I think the first and foremost to consider, if we expanded Medicaid, how many federal dollars would come into Alabama? That would be over $906 million in 2026. So that's additional revenue or money coming into the state system. That's really important. There could be opportunities to increase taxes on cigarettes or sugar-sweetened beverages. To think about the federal income tax deduction. I know there's other tax experts in the room as well, but there are options for a state like Alabama to be thinking about how to produce the revenue it needs to support the Medicaid program and the state healthcare system. Okay, so to wrap it up, we were just so pleased to, run these numbers. We didn't know where they would come out. It might be like it just kind of breaks even. We still feel like this is an important thing to do, but maybe it doesn't make economic sense. And we weren't really sure how this would come out. But when you run the numbers for Alabama, it really does make sense, right? It still makes economic sense to expand Medicaid. So that inaction on Medicaid expansion, it means the state is leaving $71.8 million on the table just in 2026. And that inaction on Medicaid expansion also means, tens of thousands of state residents don't have access to affordable health insurance and remain uninsured. So I think that's why everybody's here today. I'm so glad to see the room so packed with people concerned about this issue and wanting to talk to their lawmakers. Really happy to answer any questions about this or other aspects of federal changes and how that may impact Alabama.